People will not make.
Good evening, everyone. We are just promoting our last few speakers and panelists as to the panelist platform. Then we shall start. Welcome to our webinar. Just give us, we'll start at 5 past the hour, just to also give people to join. All right. Good evening, everyone. Welcome to our webinar for today as part of our International Youth Day activities. We are happy to have you here. My name is Dr. Marie-Claire Wangare. I am part of the Human Rights Committee that is steering the activities for the KMA Youth Month. I'm joined by Dr. David Othiambo, who will be our co-host for today's webinar, alongside our vast experienced panelists with different expertise on the topic. Our topic is reproductive, maternal, and child health plus nutrition and social media and the effects of that. And we welcome you to ask your questions in the Q&A section as they come up, and we will answer them during the Q&A part. Mine is just to welcome you to this webinar and to just give a small background on why we chose this topic. With the world focusing on universal access to RMNCAH services, as we say it in short, it's important to see how social media affects the delivery of these services and the implementation of universal health coverage. Currently, more than half of the world's population is under the age of 25, and we need to find a way to have intergenerational solidarity, working together towards pushing for the overall aim of health for all. The International Youth Day was held last week on Monday under the theme From Clicks to Progress, Youth Digital Pathways for Sustainable Development. And about 75% of the world is connected between the ages of 15 and 24, which is the youth demographic as according to the United Nations. And that's more than 10% of the rest of the world. So as we discuss this topic, I welcome you to share your thoughts, share your questions, and just actively engage in the webinar. So with that, I'd like to hand over to Dr. David Othiambo to take us through the panel discussion. Thank you.
Thank you, Marie-Claire, and thank you everyone for joining us for this conversation today. I hope you can hear me loud and clear, and we're all set for the evening. Please help me confirm that you can hear me.
Yes, we can.
Fantastic. Thank you so much. So thank you everyone for joining us for this conversation. And basically the essence of us having this conversation in line with the continuing engagement that we've been having around commemorating International Youth Day. And the conversation today is more about what is the role of social media in the attainment of reproductive, maternal, neonatal, child and adolescent health and nutrition, interventions and actually milestones that we are all hoping to achieve. And as we are getting into that conversation, that the question we need to ask ourselves is, as young professionals, as young people, how are we using social media channels and social media platforms? How can we leverage on these platforms actually to advance our aspirations to ensure there's universal and reliable access to maternal, neonatal, and reproductive health services wherever they are and wherever we're dealing with people in different walks of life? So as we're getting into the conversation, I'll be introducing the panelists who we'll be discussing conversation with. We have Dr. Hope Simiyu, who is a medical doctor and the host of A Dose of Health. We have Dr. Dana Marion, the KMA Secretary General, Kenya Medical Association, that is, for those who don't know. Then we have Mr. Kelvin Thiga from Women in Global Health. And also, finally, we have Ms. Onyedikachi Ewe from Coalition for Women's Health in Africa, who is also representing COA in this particular session and will be sharing her insights on this conversation, highlighting the role of social media in the attainment of reproductive, maternal, neonatal, child and adolescent health and nutrition aspirations as we have as a continent. I would look at it from that perspective, but also as a general healthcare workforce. So as I invite my panelists, I would just want you to turn on your cameras. Then I'll send off the first questions. Fantastic, great. And feel free to just take the first moment. I'll start with you, Dr. Hope Simiyu. Maybe just take a minute to introduce yourself so that we get through the introduction through the room first. Thank you. Over to you.
Thank you, David. Can you hear me?
Yes, I can hear you perfectly well.
Okay, great. So my name is Dr. Hope Simiyu. As he has mentioned, I am a medical doctor and a health advocate. So I have been advocating on social media for the past 3 years, And I believe that is why I'm here to speak on that topic. And yeah, so thank you for inviting me.
Thank you so much, Hope, and we're glad to have you here with us as well. I'll give a chance to Kelvin to just introduce himself. Kelvin, over to you.
Okay. Hello, everyone. I'm glad to be here. My name is Kelvin Thiga Mojoki from Kenyatta University, young researcher with Kenya Medical Association, and a sexual and reproductive health advocate and researcher as well. So I'm excited to be participating in this conversation. Looking forward to more engagements here. Thank you.
Fantastic. Thank you, Kelvin. And the last person that I'll be introducing before Marian joins us is Onyedikechi Ewe. Maybe just take a moment to introduce yourself as well. I think she might not be in a position to speak at the moment. So I'll start with you, Hope. And my first question to you is, looking at the work that you do as a social media advocate and the work that you're doing and hosting a dose of health rather. So as a medical doctor and a health advocate, through your Instagram account and the work that you're doing, what are the greatest strengths, weaknesses, and opportunities, including threats that you see in the use of social media to improve health-seeking behavior around RMNCAH plus N?
So that's it's a weighted question. But first of all, I like the focus on reproductive, maternal, neonatal, and adolescent health, because I think we all know, coming from the health space, that is they're very underserved communities. So it's great to focus on them. So when it comes to social media, there are a number of strengths, number of weaknesses, opportunities, and threats. And when it comes to strengths, let me focus on three. Of course, the first one being accessibility. Access has always been one limiting thing when it comes to health. And it's so great to see that we have something that is breaking down those barriers. So when it comes to accessibility, it's like a two-way street. So for me, as the doctor, I have access to people I would not ordinarily be able to reach. And this is because of distance, it's because of time difference. Now I can reach them by just the click of one button and just putting out content. And people who also don't have access to this healthcare information also have access to now the information that I'm putting out. Because, we tend to think that there's a lot of health information out there, which is very true, but it's not simple information. It's very complex. So being able to break this information down into a simple form and make it relatable to people, that just solves one problem of accessibility. And then number two is engagement. It's real-time engagement. So as you put the information out, you're engaging with people based on their experiences, clarifying things that they haven't understood, answering their questions, and you find that interaction is more effective in terms of influencing health-seeking behaviors, because people get to understand at a personal level, this is how it affects me. And if I do this now, this is, a positive direction. And if I wait, it can lead to other negative, things that can happen. So that one-on-one interaction and the engagement is very good. And social media has brought that out in a very good way. And then the last point that I'll focus on when it comes to strengths is there's so much creative freedom. So people are used to seeing us as doctors behind a desk with a white lab coat with a stethoscope, but now we're trying to break that down so that I can be relatable to you. Because the same challenges that you face as a patient are the same challenges I face as a doctor. Because remember, as a doctor, one day you'll be a patient. So that relatability aspect is so important, and also the creative freedom, because you can make a video, you can have just static content where people are able to read the information, you can have Q&A sessions on your stories. So there's just a number of ways that you can interact, and the creative freedom is actually so good. So those are just some of the strengths, but I think the main one is just accessibility. When it comes to weaknesses, there are also quite a number, and I think the one that we all struggle with is misinformation. So there's a lot of misinformation out there, and that's just because social media is there for everyone. So anyone and everyone can put out information as content. And there are not a number of people who are regulating this content. So there's a lot of misinformation out there, and I'm sure we all witnessed this during COVID. And it's so hard to dispel this information, because remember, when we're trying to influence behavior change, Rome wasn't built in a day. This is not something that will happen today. So it takes time to try and dispel these things, because people have really believed them. And a good friend of mine, she's called Dr. Claire Kinuthia, she really says, people will believe anything before they believe a doctor. So that is one of the weaknesses I think we have when it comes to social media. Another weakness is it actually is a lot of work. When you hear content creators saying that they are working, it is work. So you get a lot of fatigue. It affects your mental health a bit. So that's also a weakness. And you find that you need to also feed yourself, take breaks where you can. Also, don't follow the numbers, because of course you get inclined to following the numbers. How many views do you have? But you need to remember that at the end of the day, even if you've reached one person, that is effective, that is impact, especially when it comes from health. Then another weakness that we see is the algorithm. The algorithm really pushes your content to people who are like-minded, so people who relate to your views, and that can put you in a bubble. But remember, when it comes to healthcare, it's health for all. So you want your health information to reach as far as it can go. So sometimes the algorithm can literally put you in a bubble. So those are also just some weaknesses that we have. I don't want to say regulation here because I'll put that as a threat. Yeah, so when it comes to opportunities are endless. And the first one I'll say is empowerment. There is nothing better than empowering a patient, because there's one thing I've learned, that an empowered patient is so helpful for our healthcare system. The more you're able to know, the more you're able to do when it comes to your health. And any doctor will tell you it's so effective to work with an informed patient, because remember, you come to see your doctor once, maybe once a month. If it's a chronic condition, once every 2 months, once every 3 months, or once a month. It's just that one day that you're with the doctor. The rest of the time, you're actually alone. So it's so important for you to be equipped with the information to manage yourself, even when you're away from the doctor. So that is one opportunity. We empower patients to be able to be proactive when it comes to their health, to enable them to make informed decisions concerning their health. Then another opportunity that we have, of course, is collaboration and partnerships. So when it comes to partnerships and collaborations, this is with other doctors, it's with other content creators, other influencers, organizations, brands. So it's very vast. And the thing is, what you're trying to do is to amplify a message. And remember, when it comes to amplifying, that is making noise. It's making it reach as far as it can go. So that is also another opportunity. And of course, even paid partnerships come into play. So of course, if you're going to work with a brand like, let me say, Johnson & Johnson, or if you're going to work with a skincare brand, that's an opportunity to earn also for you. So it's very beneficial for a doctor, because you're also giving your expertise, but at the same time, you can get paid for it. Then the other opportunity is you're allowed to be as creative as you can be, because these apps and these social media platforms, they give you creative freedom. If you want to have videos, if you want images, if you want, you can play with your content as much as you can and make it as appealing for you and also for your audience. Because remember, we're living in a digital age and our concentration spans are so short. So you have to try and find a way to make your content as engaging as possible, but at the same time to keep the key points, because you don't want to lose the message. So those are just some of the opportunities we have. They're endless, but I think those are just the key ones. That's, I keep encouraging doctors, if you can just speak on the issue, because imagine you're able to do this, you're doctoring from outside the traditional office. So that is an opportunity for you as well. When it comes to the threats, a very important one is depth limitation. So because of short form content performing very well on social media, it's not very hard, but it's difficult for you to go in depth. And when you don't go in depth, you lose a lot of, let me say, beneficial information for the patient. And for most patients, for most people who are engaging with your content, they're not going to go back. They come to get this information from you. So you try to be as broad, but also as simple as possible, and try to pack in as much information so that they can get, let me say, enough information from you, because you don't want to miss anything. So yeah, depth, limitations when it comes to depth is one threat. Then another threat we have, of course, is regulation. As I mentioned, there's a lot of misinformation just because there's not enough regulation out there. What is health content? Who is regulating this health content? Is it actually true? Is it best practice? Is it ethical for me to put this information out there? Sometimes it's not even about the content you're putting out, it's the how you're putting out that content. So regulation is something that is still trying to catch up when it comes to social media. And I am 100% sure, okay, not 100, let me say 90% sure that they will eventually catch up. And it's good to see that even like now the ministry is prioritizing digital health, and social media is one of the aspects of digital health. Then the last threat is burnout. So as I mentioned, content creation is work. It gets exhausting. And also sometimes people actually put so much of their resources into it. So you can get burnt out, not only physically, even financially. So those are just some threats that are there around the social media space when it comes to healthcare content creation. Yeah.
Thank you so much for that, Hope. It's really insightful, the work that you're doing with the content you're bringing into up to the people. And hope, actually, the key bit is that you are moving from the conventional doctor behind the desk, writing prescription parts and whatever it is, and engaging with people in their most comfortable space, the social media platforms. And majority of us actually thrive within those spaces. So I think that is a good piece that we're looking at. And the question that I would be keen on, maybe I'll get back to you on this after I move to the next person, just as a breather.
Okay.
We look at it in terms of looking at the algorithms and all that, but also the clicks and the numbers that you talked about as a threat. How do we get to have people working towards actually delivering the value rather than going for the clicks? Because we've had such a situation, and you talked about it as well in misinformation. Because people like such kind of content, I'll give it the noise that it wants to get because I need the follows, I need the likes. But as much as those likes are driving engagements and even growth on my social media handles, it might be against what is really ethically acceptable or recommended. So that is something that probably we need to think more about. But other than that, for me, the next question I'm going to Dr. Marion, and thank you for joining us. So I'll give you a chance. I hope after, just take a breather, you can take a glass of water. I know the questions were really loaded as well. So yeah, so Dr. Dana Marion, thank you for joining us. So my question to you is, when you're looking at it in terms of the role of social media in driving access to reproductive, maternal, and neonatal health, what are some of the key advances that are being driven from a KMA perspective, and how is KMA using social media platforms? Maybe if you're here, you'll maybe share some of the insights, and also how some of the doctors who are here can engage in such activities from KMA.
Thank you. Good evening, everyone. So sorry, I had some issues with my gadget. I'm also not able to project the video. If I do, I will lose the voice. So for me to optimize, allow me not to use the video for now. I might, once it's sorted, I might join in on video. So so we are going to look at not just the role of Kenya Medical Association, but actually the role of associations and societies. And one of the things that we want to look at is, number one, what is really our hope, and what is it that we want in this field, where we want to go. So we are looking at, number one, we really want to ensure we are delivering quality health services. And this is not just to the Kenyans, but also to even attract external customers to us. I'm sure you've heard of our interest around things to do with medical tourism, and also just really looking forward into improving our brand and making people know who are these Kenyan doctors and their teams, and how do they work. So number one, our role in associations and societies is to actually work towards improving the health-seeking behavior of our clients. And number two is to ensure that we maintain the demand for service. So how do we do this? So the very first thing we do is we create platforms where we discuss various issues. So in KMA, one of the things you're going to notice is that we operate as committees, and you will realize every single committee actually has different roles. So I will give an example. So we have the Public Health Committee. The Public Health Committee is very specific on all the public health matters that affects the common mwananchi, basically that affects us. So what do we do? Number one, we have a calendar of events. So we look at the year round, and we look at international events. We look at national events, and we plug in. So we also look at where we need to put our voice. So as KMA, one of the things you will realize is that you will hear we are put, like for example, we have put forward a statement on things like antimicrobial stewardship. So what are we aiming to do? We are aiming, first of all, to educate the health workers, including the doctors, where we are in terms of the position of us as associations, in terms of how do we plug in, what is our roles. And therefore, we also educate them, mwananchi, and tell them this is where this should be. we also tell the government our expectations. So we are literally, in our statements, we are communicating to all stakeholders. And most of the time you will realize that this public health committee will do their intensive research. And by the time we are moderating and releasing this statement, it is a statement that we can share to the world and tell them this is where we are, because we have referenced various, let me call them various well-known reference bodies, and we are now looking at them and we are setting this space for our country. Now, so one of the things I will maybe talk to our doctors and even health workers is look at what is in your association, for example, what is in your society, where can you plug in? And one of the things you will realize is that when peers come together, there's a lot of power in what all of you can do together. You will realize that actually we have different strengths. Some of us are very good in public speaking. Some of us are very good in doing research, being very creative around specific things. And I'll give an example. If today we wanted to communicate about preventive strategies, maybe against sexually transmitted diseases, someone will come there and really put it out there on social media, on the various modalities that we have, and that person will communicate. Another doctor will try that and they will not be able to. So what do? We try as much as possible to identify talent. So as associations, we will pick talent amongst us and we will tell you, please run with that, because we've actually seen it. So for our patients, one of the things we will do, and you will realize you will get involved in some of these engagements, you will see us talking on specific media platforms. And this can be just short engaging posts. So you realize there's something that is being put out there, and it's just, I can call it like maybe a poster, and it's communicating something. And I'll give you an example. In the World Breastfeeding Week, you will see specific statements coming from specific individuals that are running a specific message. And this can be done to social media using short posts where they use posters. Then we can actually, one of the things we use in KMA is we use a lot of visuals, and you can see us using things basically in infographics and some things that can make you get attracted to what are these guys trying to communicate. And I think you've even seen that even when we are trying to tell you about our webinars and what it is we are trying to communicate, then you will also see the messaging in specific different webinars aimed at different people will be communicating again differently. Then one of the things we also use social media a lot is by doing regular updates, and you will realize that we keep on doing this, and this will be in various platforms. So the other thing we look at again is, I think you've seen us in mainstream media, and you can see engagements around, I think, the hot topics that are trending. So if you're talking about social health insurance, you will hear us talking about that. If you're talking about human resource for health, you will see us talking about that. During the COVID, you saw the role of KMA in actually moderating and mobilizing and protecting health workers. At that time, you realize we also went ahead to look at how is it that we can protect the physician's health. So we use various platforms and we mobilize various roles. Then the other things we also do include polls and surveys. And once in a while, we will engage the public and we will ask specific questions about specific things. And then sometimes we could do some specific direct questions. What is it you think we could do better? And this, most of the time, we do it to our members. So we can also try and use, especially the young doctors. We have a committee within us, that is the Young Doctors Network. And I think you've seen their role in so many issues, including just around the most recent activities that is around the, what was this? The finance bill. What did the young doctors do? They mobilized themselves, one, to do blood drive, which they actually do up to today. Number two, and they're using social media platforms to call upon the public to actually participate in these activities of things like blood drives. You saw them pitch up a tent to try and help people that were getting injured during the period that we were having those demonstrations around the finance bill. So we do organize, but also as we organize, we do actually put out social media information that is able to tell you where we are and what we are doing. Then the other thing you will also realize is that even when the same young doctors, I think, were pushing for issues around internship, you saw the same things. So we use the social media in communication, we use social media in information, we use social media to interact, and we use even influencers. Some of our doctors are content creators. Some of our doctors are very talented in coming up with various categories of health information, and they do it very well. So we utilize them a lot to pass various messages. We do various campaigns, and we also put out various targeted messages, and sometimes we would segment the population that we are targeting, and we would say, this time around, we want to talk to the young, maybe young people in the universities, and maybe we are targeting reproductive health. So that's basically how I'll briefly put it down, and back to you.
Thank you so much for that. And I think that was a comprehensive one, looking at the role of the platform of the professional associations for what they are supposed to do, and leveraging on the capacities and the strengths of the members, because ultimately then it is the members in their own uniqueness and capabilities that help us drive that value, but cleared on what priorities the association has. Thank you so much for that, and really appreciate. So I'll move to the next person, and I'll come back to you as we move towards into the conversation. I'll go to Kelvin Tiga from Women in Global Health. And Kelvin, for me, the question is clear in terms of, based on the work that you guys have been doing from Women in Global Health, there are a couple of reports that you've rolled out and released, and some of these are looking at the key gaps in terms of leadership and representation of women in leadership. One of your reports indicates that actually 42% of leadership in healthcare is women, which means the 58 are men. But also a follow-up report post-COVID-19 and looking at the Great Resignation, we see a trend where actually most of the people who are leaving the workforce, from the healthcare workforce basically, who are women. What are some of the drivers to this, and how can we actually close these gaps in terms of leadership to ensure that we have more women empowered into driving access and utilization of healthcare services, but also making that healthcare responsive to people's needs in the respective environments where we operate? So over to you, Kelvin.
Okay, thank you very much. And just a slight correction. I don't work for Women in Global Health, just in case I'm misquoted when I say something. But thank you. So maybe to start with a provocative statement, men are natural leaders. True or false? The other statement is women cannot lead because they are soft and their place is in the house. You see? So already you can see these are statements that have been perpetuated all over, and it has become like a status quo, and little will be done to try and correct them. And especially with the older generation, you'll see they'll be a bit rigid. So the gaps in leadership, so when we think about leadership, it's not just a matter of positions, because already right now, we are having what we are calling the XX paradox, where we are cognizant that 70% of the healthcare positions, healthcare providers, is being provided for by women, but only 30% of the women hold leadership positions. So what you can already see with that paradox is there is gross underrepresentation within the leadership. Now, the other challenge is you've talked about resignation, and I would like to put it more into context. So when COVID hit, and especially in the high-income countries, what happened is there were really, really big shortcomings when it came to the recognition of the role in the how they were playing their role in the pandemic, and their remuneration, and even just things such as the PPEs that were being put out, they were more male specific. Now, what happened is in the high income countries, more women, and now we are healthcare providers from the lower income countries. You can see them now migrating. So that great resignation in the high income countries is being met by another great migration from the lower to the higher income countries. So now what you can see is it's creating a vicious cycle of creating more and more disparities within the healthcare system and the representation of women, and especially now even locally, whereby we are exporting more of our good talent. And when we thought that this could easily be resolved, we are having even now the high-income countries strategizing and even having better policies that reduce the amount of times now reducing the restrictions. So that first highlight is the gaps within the leadership. Besides the already existing underrepresentation, it is still a growing thing. Therefore, understanding what are these gaps and where do they occur, it becomes the first point to try and resolve this. So the conversation has been, it's youth month, and we are trying to see how do we move from clicks to progress. And then, but we already have, and then the question is, we already have social media here. So how do we move not just from clicks to progress, but clicks with progress, in the sense that even as we already have a tool, we don't end up really putting it away and then just, and even adopting it for our betterment. So I started with two statements. I said that men are natural leaders, and for sure that is a myth, because leaders can be born, but they can also be made. Women cannot lead because they are soft and their place is at the whole place. That is false. Women can lead, and actually they have proven that they could also make very good and awesome leaders. So now the second part of the question was around misinformation and disinformation. So we are at an age whereby, as the first speaker presented, we are dealing with unregulated content. You wonder that you, as a healthcare practitioner, when you encounter a let's say a teenager, and you want to educate them, you might feel a bit, by the ethics of the practice, you might feel a bit restricted, or even by your own morals, you might feel a bit restricted to share on the amount of content you want to share with them. You will consider it explicit, right? But then again, when you go to social media platforms, and where majority of these young girls and boys are, they will have unregulated content. So besides social media being a tool, how can we as leaders, how can we people in governance use that platform, use that tool to make the messaging as to be appropriate for that age, and to be able to fight the misinformation and disinformation. So why I'm trying to bring about this point of misinformation, disinformation is that when such information is allowed to propagate unchecked, it will continuously erode the trust within the healthcare system, and even it will undermine the different campaigns. When we want to ask for more representation of women in leadership, they'll be told no, their place is X, or no, only men can lead. So the other part is messaging. So one, we have seen that we as healthcare providers, or we as leaders, we have we hold a very unique position when it comes to releasing content, in that somebody, as much as somebody might be a bit skeptic or might be a bit reluctant in trusting or believing a healthcare provider, the word of a doctor at least means something. Therefore, understanding the messaging really means a lot. So by this, let me give you an example. You have talked about the XX paradox, 70% of the women, but only 30% in leadership. So let me now break this down further, and you understand, for you to understand that although we have 70% of the women within, of the healthcare providers being women, most of them are being contributed to by two cadres, nursing and midwifery. The other challenge, on the flip side, you can say, this is really good. We have more women in healthcare. It's a really, really good thing. But then on the flip side is we have less of them in the decision-making cadres. And that is, for example, when you look at most consultants will tend to be men. When you look at some of the specialties, you'll find that women are underrepresented. So you can see it's you, before going out there and sharing any messaging as a healthcare provider or as a leader on such social media platforms, you need to understand. So when I say 70%, how do I package that information as for people to understand that 70%, it's a quantity, but it's not a representative of the quality. It does not really represent the number of people making such decisions. So, but I would say that even in advent of all this, all is not lost, because one, we already have such campaigns which are bringing up different players in different sectors, men and women alike, to just see, to shine light on what is really happening. On the other side is, when you look at the pipeline, the dynamics are changing. Right now, we are saying that there are very few consultants who are female, there are very few doctors who are female, something of the sort in terms of numbers. But when you look at the pipeline, the people who are getting into the medical schools and being churned out of medical schools, some of the younger professionals, the numbers are changing. And maybe, what has been speculated is maybe taking 150 years to have more women within these leadership positions and even decision-making positions. That time will drastically shorten. The other part is a research that was done by the Kenya Healthcare Federation, and it's showing that although around 50% of the organizations, that is NGO, the public sector, and also the private sector, when you look at objective measures such as similar remuneration, skills, and experience. So are you being remunerated because of your skills and experience, or are you being remunerated because of being male or female? You can see that in all these different sectors, at least they were posting more than 50%. I know more than 50% in terms of, truly, if you're a leader, you'll be remunerated because of particular objective measures rather than being either male or female. And I will say that is progress, and that is a ray of hope. The other part is when you look even at that study, it was saying that the respondents are saying that most they feel supported by the leadership, and the leadership is very proactive when it comes to reducing inequality and sexual harassment. So what I'm basically trying to say is, as much as we are going out there and even understanding all these gaps and however glaring they might be, we have some progress. And even when we are looking at from clicks to progress, it's also good to be cognizant of the milestones that are being made. And even not to forget the Kenya Medical Association by itself. You can see that you have quite a good representation of female leaders within the different decision-making organs. And to conclude, there are different things that we as leaders there are different things that we as leaders in healthcare can do, whereby we are looking at building the quality of leaders in terms of, one, you recruit more women, you give them more opportunities to lead. But while you're doing that, don't just concentrate on the numbers. Look also at the quality of it. Are you remunerating them fairly? Are you supporting them maybe through mentorship? Are you appreciating and recognizing their efforts? Are you able to allow or even to facilitate to facilitate them when they have competing tasks? Are their views even heard when there's a decision-making process, so that we don't get so fixated to the numbers, getting to a 50-50, and then we forget that we also need the quality. It's also the quality in representation. And by the end of it all these, package it well through proper messaging, use the tools that we have, that is the social media, and communicate this information in a way that can be consumed even by other people, so that it cannot be countered or counterproductive, whereby when we try to do this, on the other side, people are trying to continue and drain with misinformation and disinformation. Thank you very much.
Thank you so much, Kelvin, for that, and thank you for the elaborate discussion. I think looking at the facts of what we have, the key message that you're looking at is that as much as we're seeing more women in healthcare and delivering impactful interventions, we need to ask ourselves, in what levels are they operating in? And how do we ensure the system is working robustly? And maybe a challenge that I will be posing at this platform for all of us and even for the audience who are participating, maybe just in your chat, what are some of the key interventions that could be driven to ensure that we have more women and more female doctors and healthcare workers getting into the not so conventional areas where we'll be looking at, maybe in the subspecialties, where we are keen on seeing more women taking leadership roles and actually being in those spaces. What are some of the ways that we could make that a reality? Because then we are able to drive the impact of what we are hoping for, and therefore that those advances would be there in a critical way. And the other key question that would be there is, as much as the global community, and I think this is one thing that you mentioned, Kelvin, with more restriction, actually more relaxed restrictions on getting access to these countries, most of our healthcare workers are actually living, and that includes even the women from the sub-Saharan African, basically low-income countries, low and middle-income countries. What are some of the drivers? How do we manage that to ensure that our local context is also not put at risk? Those are questions to the general audience and also to all of us in the panel, so that we can think through it and think of better ways of addressing these gaps that we have in the ecosystem and whatever we're looking at. And thank you for the correction as well. Sorry for assigning me to the Women in Global Health Committee. So as I'm going to the next piece and the last question that I'm going to ask to Ms. Dikachi from Coalition for Women's Health, yes, I want to miss it again. So from a private sector perspective, we understand that the private sector has a critical role and a critical contribution in healthcare access and healthcare delivery in our continent and globally as well, from pharma side to all the care delivery at the bedside. One of the key questions that I would be keen to ask of you is, what private sector mechanisms and interventions do we have that are coming in for the continent that we can take advantage of to deliver on our aspirations to ensure that there's universal access to reproductive, maternal, and neonatal health? And also from your work experience in advocacy, any key tips and insights that we can take advantage of, successes that you've seen, and that we could also kind of work along and gain insight so that we're able to drive a momentum that achieves its objectives, but also guided by the key outcome that you're seeing from a private sector perspective. So over to you.
Thank you, David, and thank you to Kenya Medical Association Human Rights Committee for putting together this event. And I want to also say hello to the speakers that have spoken before me. I'll start from social media. The tempo has been social media, women in leadership, and then I'll wrap it up with private sector recommendations. Yes, my name is Dikachi, where I work with Nigeria Health Watch. We are a health communications and advocacy not-for-profit organization, and we focus on working with the government actively, engage them and support them to create better health outcomes for Nigerians at large, and also to provide credible information around health matters that are relevant to improving health outcomes for Nigerians and Africans at large. So we do this basically through various communication strategies, and one of them is social media advocacy. And I'll just share a few best practices that we use in media advocacy, in our advocacy interventions to improve these health outcomes. So When curating our messages, this is key, identifying your target audience. Identify your target audience. Who is this message targeted at? Is it the policymaker? Is it the healthcare worker? Is it the young people, the adolescents, the mothers, or the caregivers of children under 5? Once you've been able to profile and segment your audience, then you design specifically tailored messages, putting in perspective your audience preference and their behavior. So their behavior and their preference will help you choose how you want to package these messages. You want to do this through journals, editorials that they can read. So for us at Nigeria Health Watch, we use compelling content in the form of storytelling. So weekly, we have editorials that are published we have the thought leadership. So the author is writing from his thought leadership perspective. And we also have the solution journalism stories, we call them SOJO, or torchlight stories. So other than reporting the health issues from the problem perspective, we report this from the solutions perspective. What are people doing around the world and in that health area to bring about solutions? Both government, development agencies, what are they doing to bring about solutions in that health area? And then we tell the story to engage our audience, inform them, and also evoke responses that will bring about an improved health environment for everyone in the health sector or those affected by the public health issue. Now, do you want to use infographics and visuals? This will also influence the channel that you're disseminating your content through. So you can use interactive live Q&A sessions. These are some best practices also. So in addition to using editorials, text that your target audience can read and get informed and engaged, you can also do live Q&A sessions like we are having a webinar now. Some of these sessions go out on through the X space, which we used to call Twitter Spaces, video documentaries, podcasts. These are all channels that avenues that you can use to package your compelling content and disseminate this. Then having identified your audience, design and the message format, you now want to find out the accurate dissemination channel that you would be using to reach your target audience. So your platform selection, you have to choose an appropriate social media platform based on your target audience preference. And you want to read the policymakers, you'll be considering platforms like Twitter, LinkedIn, that you can use in engaging them actively and getting their quick response and feedback. For the young people, adolescents, you would want to consider Instagram, where you have, where you use infographics, visual content. And then you would also look at optimizing your content, to suit your social media channel. For instance, for TikTok, you have to use shorts videos, 30 seconds videos. And for LinkedIn, you want to use a text-based format. And for YouTube, you want to use documentaries, and you have to keep it really within your audience attention span. Your message also should have a clear call to action. What is your advocacy ask? If you're writing a message for the policymakers, what do you want them to do? What is your ask? If it's for your the healthcare workers, the young people, messages on sexual and reproductive health, your call to action can be as simple as register for this event so that they can get more information, or visit a healthcare center to get more counseling on this health information and to access services. So your messages should be infused with clear call to actions. Also, some best practices that we deploy is leveraging World Health Days to, jump in the trend of the conversation. For instance, this is International Youth Month, and we are leveraging the period to discuss around matters that affect young people. So in using social media, you leverage World Health Days to design and disseminate relevant messages that will reach your target audience. We will also look at collaborating. The place of collaboration in expanding your reach cannot be overemphasized. We use influencers to amplify our messages and broaden our reach. We also use collaborate with other organizations who have similar interests, and we collaborate to spread the messages on their platform, and they also utilize our platforms to broaden their reach. So it's a two-way thing. And communication cannot be complete without feedback. So you are reaching out to your audience, feeding them with health information. You need to set up a mechanism also to get their feedback. And we do this through polls, through surveys, through interactive live sessions like we have here. And insights from these feedback are also used to modify and refine strategies. And getting this information also will help you to track your engagements, and measure the effectiveness of your social media campaigns. As Dr. Hope mentioned that social media curating content and disseminating is a lot of work, and I agree with that, because you have to maintain a regular posting schedule. You don't want to leave the gap for your audience to begin to source for information from a non-credible source. In fact, I think in the 21st century, in addition to our basic need for food, water, air, another basic need is information. Young people are on their keypads 24/7 seeking information. So you don't want to leave that gap and leave room for rumors, misinformation, and myths and misconceptions. So you want to continue to post regularly, and you want to keep your messages consistent, credible, and correct. So that takes a lot of work. And you also want to debunk myths and misinformations as they come on board. So we use social listening to also plan to respond to misinformation, get what the audience, your target audience know, or what is the trend in the health space, what is the information in the health space. You get this information through social listening, and you respond with correct, relevant, accurate information. So this is some of the best practice that we deploy at Nigeria Health Watch. Yes, you also mentioned yes, Nigeria Health Watch is a member of the coalition of women's health in Africa, which is an engagement platform for knowledge, dialogue, and action for improving women's health in Africa. And the goal is to seek to unify private sector organizations that are working in with a similar objective to foster that enabling environment for women's health. So the role of private sector in delivering maternal and newborn health services, especially in low and middle income countries, is huge. In low and middle income countries, 1 in 5 childbirth is the delivery is taken in a private sector health facility. In Nigeria, where I work and reside, more than half of healthcare services are delivered by the private sector. And by private sector, I mean the private hospitals and clinics, the pharmaceutical companies, the community pharmacies, the patent proprietary medicine vendors, which we'll call the chemist shops, non-governmental, not-for-profit health organizations, health foundations funded by private sector, HMOs, and private health, private sector laboratories and diagnostic centers. So you see that the demand or the supply of health services and products is huge from the private sector angle. However, we still have that, gap in terms of properly integrating the private sector into the health system. Last year, Nigeria Health Watch, and I think it's a good place to mention that we hold an annual conference, which is the Future of Health Conference. Our theme for 2023 was focused on the private sector as a catalyst for a resilient health system. And the focus was on the private sector's potential to drive innovation and enhance care, enhance access to quality healthcare services. I'll drop the link to some of the articles that were published last year following that conversation. The panelists gave strong recommendations on how the government can leverage private sector capacity to improve the health system. So I'll just talk around the recommendations from private sector in improving the health system, focusing on the 6 blocks of the health system: leadership and governance. So the role of government primarily is to provide that enabling environment, to develop institutional and policy frameworks that will help the private sector better provide quality healthcare, especially in underserved areas. So on the side of the government, they can support the private sector with low interest loans, subsidies on procuring medical equipment and commodities, because on one hand, the private sector, yes, wants to meet a need, and also, as much as we might want to shy away from it, they also want to go away with some form of profits. So if they invest so much, they should be able to provide quality as well as continue to be in business. So the government can do this by providing that enabling environment, subsidies on procuring health commodities, medical equipment, soft loans, low interest loans, so that they can continue to provide quality RMNCAH and nutrition services. For service delivery, there should be huge investment in infrastructure. There should be investment in upgrading health facilities in underserved areas. We talk about women not wanting to go to the health facilities for deliveries, but how can you tell a woman or who has a more convenient facility in the sense that delivering in her home in that rural setting is more comfortable than going to the health facility. Now, this opens a gap for her to want to access the services of traditional birth attendants who may not be properly trained to identify high-risk pregnancies or even know the danger signs when to refer. And this keeps telling on our maternal mortality indices. So I have been opportune to visit health facilities in the rural settings where the bathroom provided for the new mother who has just put to bed to take her first bath is not dignified. So if the mother does not have access to quality facilities at those health facilities, then there's that gap that impedes them from accessing care at the health facilities. But if these health facilities are upgraded, are standard, provide that environment that is conducive and that is promising for respectful care, they would access care there and take their deliveries there, and this will improve maternal health outcomes. Private sector has the potential to bring about digital health solutions, innovations, and research. So government should partner with private sector to leverage this capacity in providing mobile health technology, electronic medical records, proper health information system, because data is, everything. We cannot make informed decision without knowing how many people we are actually deciding for. When we talk about health workforce, another pillar of the health system, private sector has that capacity to also train. So the health workers in these health facilities trained? Do they have the requisite knowledge and skills to provide, for instance, youth-friendly sexual and reproductive health services at the facilities? So if a young person walks in to access sexual and reproductive health information or services, are the health workers trained and equipped to provide these services without bias and give them credible and comprehensive information? What is being done about workforce retention? It's not just enough to train and then these people are not motivated enough to remain and continue to provide services. So the recommendation is that this workforce should be incentivized. There should be initiatives that improve health worker retention. And of course, the number, as we're improving the capacity and the quality of the existing health workforce, there should also be an increase in the number of those working in these health facilities so that there won't be a strain on the existing health workforce. And of course, healthcare financing. When we talk about universal health coverage, talking about every member of the society, everyone being able to access quality healthcare without fear of running into financial problems. So what are the modalities for people to access healthcare without fear of financial risk, having financial risk protection? So private sector health management organizations should ensure to meet required standards by the national health insurance authorities in various countries. In Nigeria, here we moved from the National Health Insurance Scheme to the National Health Insurance Authority, and an act has been, a bill has been enforced from having just voluntary health insurance to mandatory health insurance. That way, we're inching towards achieving universal health coverage for everyone. Finally, I'll talk about supply chain management. There should be available commodities, contraceptives, nutrition supplements, and this can be done by improving the supply chain. So we're talking about reproductive, maternal, and newborn child adolescent health services. And in some facilities, drugs that are, or medications rather, that are required, that require a cold chain are kept in temperatures that are not optimal to keep that medication potent. So there should be investment in, cold chain infrastructure for vaccines and other sensitive medical, temperature sensitive medications. so that they can reach the facilities or the health facilities in their optimal conditions. I think I'll just take a break here and I get the responses and reactions. Thank you.
Thank you so much. Thank you so much for that great contribution as well, Nyedikachi. It's really insightful from the work that you're doing with Nigeria Health Watch, basically around the social media communication, health communication, and driving that uptake. And the bit about it that I love is the fact that we have to know the target audience that we're dealing with. And as you're looking at about the basic needs, when you're talking about information as a basic need, somebody told me that initially in the pre-colonial days and even most of our key fights as human beings has been about the basics of human life. Now we've gotten to a point where we are fighting for attention, because if you don't give them the right information when the attention span is on it, ultimately they'll get the misinformation or disinformation. So now we are in the scramble for attention. We have to make the best of it using the social media channels to give the right information to the people who need it. So with that, I think I'll hand it over back to you, Marie-Claire, because I'm already seeing we are almost 20 minutes to the top of the hour. Over to you, Marie-Claire.
Thank you. Thank you, David, and thank you to our panelists for the insightful messages that you've given us. So far, we only have one question, which I think we can quickly answer from Dr. KMA President, Dr. Simon Kigundu. He's a bit curious, Onyedikachi, about how your National Health Authority is structured, whether it's a function or whether it's pay.
Okay, Marie-Claire, please, can you come again with the question? If the NHIA is, I didn't get that.
How is the contribution to the NHA structured? Is it function?
The function of pay. Okay, so definitely you pay just like insurance plans. You pay. There are different insurance companies that you can get a policy and you subscribe, and then you can access care from every facility that insurance policy covers. So the NHIA Act specifies that this health insurance, other than being voluntary, it should be mandatory. So every Nigerian is mandated to have a health insurance plan, and also every employer is supposed to have a health insurance plan covering their employees. So there are different plans, and it varies from Health Management Organization, HMO to HMO, and it varies from plan to plan. But what I made reference to was the act, which moved from being a voluntary health insurance subscription to a mandatory. So that's the focus, to reduce financial risk for Nigerians so that we can attain universal health coverage.
All right, thank you. Thank you so much for clarifying. I hope the answer is sufficient for Dr. Kigundu. In the interest of time, we'll just extend by another 5 minutes just to allow us to wrap up this conversation. I think since there are no other questions, I'd like to hand over to our convener of the Human Rights Committee, Dr. Joy Mugambi, to start us off with closing remarks. And then finally, we have a conclusion and summary by Dr. Simon Kigundu, who's been with us the entire call. So over to you, Dr. Joy Mugambi.
Thank you very much, Marie-Claire, and our excellent speakers. We are so grateful to have had you in this session. I'm Dr. Joy Mugambi. I'm the convener for Human Rights Committee and very passionate about the young persons and adolescents' health. And I'm happy to have hosted this session alongside with Marie Claire, who has really done a fantastic job putting together all the sessions, and the team that has moderated and co-moderated. We are very grateful. We are looking forward to the 31st, where we'll have candid dialogues in a seated space and get to know each other much better and get to hear. I think the first thing we really need to consider is strengthening primary healthcare all over Africa and ensuring that the youth are involved in the discussions of ensuring primary healthcare is tailored towards them, and having an efficient system that ensures that they don't go through many hurdles to get the services they need around RMNCAH, and ensuring that they also are being served efficiently and commodities are available, as well as counseling services are available for them. With that said, I want to welcome the Guru of Reproductive Health and our president, Dr. Simon Kigondu, to make his closing remarks. And thank you very much for being there all through. Apologies, I could not be there earlier. I had a hospital emergency I was handling. Thank you. Dr. Kigondu.
Thank you very much, Joy. And thank you very much to the team that has hosted this excellent presentation by Hope, Simiu, excellent. Onyedikachi. It's very interesting to hear the Nigerian way that the act has taken. Here in Kenya, we are still fighting about issues of how to pay, so to speak, and there are a bit of these disagreements here and there. Diana Marion, your presentation was just excellent, and Kelvin, David Odhiambo, and we want to thank all the attendees of this session, and we have had very great lessons. All these lessons, I think, over the years, we as Kenya Medical Association are actually embracing a lot of the issues that have been discussed in this session. One of our most important actors in Kenya Medical Association is a gentleman called Peter Ogera. Peter Ogero is our ICT expert, and over the years, he has grown the ICT aspect of KMA, and we normally consider Kenya Medical Association as an ICT company with interest in health. And the KMA social media platforms are well suited for giving the kind of medical information that we are now churning out. Over time, we have become an authority, and with time, we are actually the go-to medical place for people who are looking for correct medical information to come to. If you visit our YouTube page, it is almost like a university, and even this webinar will actually be put out there in the YouTube page. Our vision is to build a portfolio that ensures that accurate information about medicine in Kenya and beyond is available at our media. So we welcome all of you to join and become members and take part in making this University of the Kenya Medical Association a reality. We want to thank the young ones for taking on the reins and running with it to ensure that KMA remains the source of inspiration for our young medical doctors. The convener of this meeting, Dr. Marie Claire Wangari, is the chairman of the Junior Doctors Network of the whole world, the World Medical Association. level. And that is evidence enough that the youth can actually go and give correct information to the whole world. And in the era of TikTok and other social media platforms, we are in a good position to be the authority in health that we want. Our vision and mission as the Kenya Medical Association is to continue to have gender equality, and it is evident that Kenya Medical Association contains the majority of male allies, where we ensure that our ladies are at the top leadership. And secondly, we also want to continue ensuring that the leadership at the top continues getting younger and younger. My vision is that by the time we hit 10 years, the president of the association will get younger and younger. We are targeting 40 years and below. And that's the only way you can ensure that associations and societies thrive. And that is Kenya Medical Association for you. So with that, I want to ask you to continue joining us in the webinars that we continue doing. Some like this, as you have seen, are away from the normal medical practice, but they are very useful for the development of the medical practitioners and of the profession. We also have other webinars that are medical in nature, but this particular one, we are pleased to be ensuring that we want an all-rounded doctor. We encourage you to join our committees, and I see some of our committee conveners on the call, like Dr. Lindsay. Dr. Lindsay there is a convener, and she's also the chair of the KMA choir. We also urge you to join all this. And thank you very much to Dr. Joy Mugambi, who has been a mentor to the youth, and she continues to be our mother at Kenya Medical Association, looking after the youth. With that, I want to bring this session to a close, urging you again to visit the KMA website, www.kma.co.ke, to pay up as KMA members, to join up in the committees at KMA, and to continue doing the social media messaging for the youth. Thank you very much and have a lovely night. Yes, Dr. Lindsay, thank you very much. I've seen you have put something there for people to click and go to, and we will continue engaging as we go on. Thank you very much.
Thank you very much, Bwana President, and thank you very much to our panelists and our participants. This webinar will not have been made possible without your engagement and without your taking time off your schedule to listen. Up next is our third out of the fourth activity, which is a TikTok Live, which will be hosted by none other than our KMA president next week on Monday, where we discuss gender-based violence and the intersectionality with social media. So do follow our KMA president at Simon Kigondu 1 on TikTok, where he'll be taking us through that discussion alongside those people who are versed with the TikTok live platform. Then finally, we will wrap up the International Youth Month on 31st of August in Nairobi, where we'll be having hopefully a hybrid symposium to discuss the intersectionality of digital health for all from an SRHR lens. Thank you very much. We appreciate you attending. Till the next activity. Have a lovely evening.
Thank you, Marie.
Bye.
Thank you.